Hi, good morning everyone. So I want to continue talking about labs today. So today I want to talk to you about vitamin D. It is its own separate lab. It's not in the chemistry panel, as the chemistry panel has your potassium, your magnesium, your calcium, all that good stuff. Vitamin D is separate. So why is it separate? So there's not a lot of studies that can actually say that we should test vitamin D regularly. Do we do it? Yeah, we test it pretty regularly. Although it's not always indicated, it's not in our books. It doesn't say, yes, it will help the patient in any of the studies. It's just an inconclusive finding. But I do have a lot of patients that say they feel better when their vitamin D is at a normal level, which is why a lot of us as providers, I think, end up checking it. So what does vitamin D do? So it helps with our bones. Vitamin D and calcium is important for our bone health. There is one study that tried to say it helped with depression. Again, it was an inconclusive study, but if you ask patients or ask people, I have had people say that it has helped. So I'm not opposed to using it. So how do we get vitamin D naturally without taking a supplement? We can eat foods that are high in vitamin D. So this is a lot of milk and dairy products. And then we get vitamin D from the sun, but some of us just don't absorb vitamin D well from the sun. So if you go in to ask your provider for all the basic labs, vitamin D may or may not be included. You would have to ask them if it's indicated for you the way your insurance works. So I would overall recommend a multivitamin with some vitamin D in it. Probably for all of us, we could benefit from that. So that's all for now. Bye.